Have you been told just relax? How about wait a year, or you're too young to worry about fertility? When it comes to fertility advice, a lot of it out there is bad. In this video, I'm breaking down the 5 worst pieces of fertility advice and not only why they're wrong, but how they can also be harmful. I'm Dr. Lora Shaheen, a double board-certified OBGYN and reproductive endocrinologist, helping people build families for over 20 years and navigate and help with advice, both good and bad. And I have heard every fertility myth that is out there and helped patients overcome, understand, and advocate for their care. If this is your first time finding this channel, welcome. I am so glad you're here. Be sure and subscribe so you get my weekly videos all about reproductive health. And if you're coming back because you have found this advice and information valuable, welcome back. I am so glad you're here. There's 2 other ways to connect with me and get educational information. Number 1, sign up for my weekly newsletter. The link is in the description below. You can get up-to-date fertility news and recommendations every week. The other way is my weekly podcast, the Brave and Curious podcast. Listen anywhere you listen to podcasts. For audio and for video, you can find the playlist here on YouTube. Now, today we're talking all about bad fertility advice and the 5 worst ones that I hear from my patients every single day. I'll explain the advice, explain why it's bad, why it could be harmful, and what you can do about it. So, bad advice for fertility, number 1, just relax. Now, this comes in lots of different versions. Just relax. Oh, go on vacation. Stop worrying about it. Oh, just stop stressing. Or how about just adopt? My friend finally decided to adopt, and then she got pregnant without assistance. I could go on, but a lot of this advice is really putting blame on something that people can't really control. A lot of it is saying, oh, you're too stressed, and shaming someone for, causing their own infertility because they're too stressed and they've just got to relax. I think people are trying to help when they give this advice, but it's really not helpful. It just shifts blame on the person that is struggling and just wants to build their family. And you know what? Stress doesn't cause blocked fallopian tubes. Stress doesn't cause, big fibroids that are impacting miscarriage risk or other causes of infertility. I do think that there's a mind-body connection. I do think that stress is very important to pay attention to, and we should all work on stress management. But just telling someone to relax when there are real, serious medical and clinical reasons for infertility is usually not very helpful and can honestly cause harm and shame and make people feel even worse. Worst fertility advice number 2, you have to wait for a full year before you can see a fertility specialist. This advice is just wrong and can sometimes be harmful because people can waste valuable time. I'll tell you where this advice comes from. It comes from a lot of blogs and textbooks and kind of, medical advice, because statistically, 85% of people who are regularly trying and regularly ovulating, having regular predictable menstrual cycles, 85% of people that are having sperm exposure about once a month, all the things, and they're trying, 85% of them will conceive within that first year of trying. And so if you're in that 15% that did not conceive, then you should definitely go and get testing, talk to a fertility specialist, kind of figure out what's going on. Now, there's lots of reasons that you shouldn't wait that long. One reason is advanced reproductive age. If the person with eggs, the woman in the partnership, is age 35 or older, age is a big predictor of fertility, and you don't want to waste valuable time if there is something like a significant male factor, low sperm count, an anatomic issue that's impacting fertility. I don't think anybody should have to wait a year, but especially if there's advanced age or you're starting your family or you're trying and the eggs are 35 years or older, the recommendation for most textbooks and medical societies is try for about 6 months and then get testing. The reason that this can be harmful is there are other clues that there might be a fertility issue other than just time. So if someone's not having regular, predictable menstrual cycles, they're not ovulating regularly, and this is a warning sign to figure out why you're not ovulating. I got a patient story for you. Someone came to see me after a year of trying And when I asked her what trying meant to her and tell me a little bit more about her cycles, she had not had a period since stopping birth control a year before she came to see me. And she just kept taking pregnancy tests because she just assumed, well, that's a great reason not to get a period. And she thought about making an appointment and kind of getting some testing, but she kept seeing everywhere that she read online that you have to wait a year before you see a fertility specialist. Now, we diagnosed PCOS. We figured out that the reason that she was not having periods is she was not ovulating. We were able to help her ovulate in a very simple way, and she conceived relatively quickly after we figured that out. But I'm sad for her because she missed a whole year of being a parent and stressing about her fertility, and she wasn't having periods. She had no chance of getting pregnant because she wasn't ovulating. And she said to me, I just wish I'd come to see you sooner. So don't be that person. Reasons to see a fertility specialist before a year: if you're having unpredictable cycles, irregular cycles, if you have a history of diagnoses that may impact fertility, like you have endometriosis, you have PCOS, you have fibroids or irregular heavy bleeding, anything that you're worried about, a chronic medical condition that might impact, healthy pregnancy or miscarriage risk. There's so many reasons to ask questions and to see someone. And doesn't have to start with a fertility specialist like me. I'm a reproductive endocrinologist. That means that I've done years and years of training and really focused on fertility. But maybe you could see your primary care doctor, you could see your OBGYN early in the process and say, hey, I am starting to try. I just want a little bit of a checkup, make sure I'm not missing anything. I don't think anybody should be shamed or denied asking questions and advocating for their care. Worst fertility advice number 3, just use an app. Okay, let me explain. Apps are amazing. We all have our phones with us all the time, and it is really important to track your cycles as you're trying to conceive or learning about your body, because if you know when you're ovulating and you're tracking your cycle, you can optimize timing trying to conceive and shorten the time to your goal. However, apps can be misleading. Some apps assume everybody has a 28-day menstrual cycle. Only 25% of women actually have a pretty predictable 28-day cycle, but that is the one that we always talk about. It's just kind of neat. It fits in our calendars, 4 weeks in a month, 7 days in a week, 28-day cycle. And that assumes that you're ovulating in the middle of the cycle on day 14. And so a lot of apps will just have you enter the first day of your menstrual cycle, and they'll count out and they'll just send you an alert and say, hey, it's cycle day 14. You should try to conceive. The issue with that is some people have variation in their cycles, and some people might have a longer cycle. Their normal cycle might be 32 days, and they might be ovulating on day 16, 18, or 20. Or somebody can have shorter cycles, and they actually have 22-day cycles, and they're ovulating on day 9 or 10. If that person is waiting for the app to tell them to try to conceive and they ovulated earlier in the cycle, they are missing a valuable window of timing trying to conceive, and this could delay their success. So apps are great. It can be great for tracking or following your cycle, learning about your body. But honestly, just a paper calendar is just fine. It doesn't have to be a fancy app. And don't use that as the only way to time when trying to conceive. I've got a lot of information here and great educational videos on YouTube about ovulation, the best days in your cycle to try to conceive, physical signs of ovulation. So this is really important. And all I'm saying is don't completely rely 100% on the app. It could be a part of your toolbox, but it shouldn't be the only way you're trying. Worst fertility device number 4, you're too young. You don't have to worry about anything. You're fertile. Hey, there is ageism in fertility. So we always talk about age and fertility, and it's just so important to realize that as the eggs and sperm age, fewer and fewer of them are able to do all the work that it takes to turn into a beautiful embryo that implants and turns into a gorgeous baby. We know that. On the flip side, young people can have fertility issues. I just saw a patient last week 24 years old. She has been trying to conceive for 5 years. Yeah, she got married young. They have been trying to conceive. I'm the 4th doctor that she's come to see. And every doctor has just said, oh, you're young. You're having regular cycles. You're fine. There's nothing to worry about. We did some basic testing, and on HSG, or hysterosalpingogram, we found that both of her fallopian tubes are blocked. So she had no signs. She didn't have pain. She was having regular menstrual cycles, but no one checked, and the egg and sperm could not bind each other. So she has tubal factor infertility, and she finally knows why she's not getting pregnant, and we're going to help her. But just because she is 24 years old, that doesn't mean that she doesn't have fertility challenges. It doesn't mean that she should be denied testing. And if you keep hearing that, just keep seeing somebody that takes you seriously and say, listen, I want testing, just the basics. I don't want to be missing anything. There is ageism in fertility. And so don't be a victim to that. Keep asking questions and advocating for your care. If you want to learn more about the HSG, or the hysterosalpingogram, I've got several educational videos here. Worst advice number 5, if you're getting pregnant, you can't have a fertility issue. Hey, that is not true. I see a lot of patients with recurrent miscarriages or recurrent pregnancy loss. And they have been told by other people, even friends, family, and other providers, hey, you're getting pregnant. Why see a fertility specialist? Just keep trying. And although on the one hand, I do believe that. I believe that every pregnancy is a new opportunity, and that it really could be that the very next time that couple gets pregnant, that they have a gorgeous baby. But if you're having miscarriages, that's a different type of fertility, and you deserve testing as well. There can be causes for those recurrent miscarriages, and we can offer testing to figure that out and counsel you about your options. So recurrent miscarriage is a type of fertility issue. So don't be denied testing or brushed off your concerns. If you are having recurrent miscarriages, you deserve testing and care. I have written an entire book on this. It's called Not Broken, An Approachable Guide to Miscarriage and Recurrent Pregnancy Loss. I'll put a link in the description below. You can find it on Amazon. It's printed only there because it's self-published, and that's a way that I can get it to my patients, on demand. So the only place you can find it is Amazon, but I do hope that that is helpful. So if you've ever been told any of these 5 things, you are not alone. There is a lot of bad fertility advice out there. I hope you've learned from this video. I hope that you have knowledge that can help you ask more questions and get your questions answered. Like this video if you learned something. Comment with questions that you have, other topics that you'd like me to cover. I love educating, and I want to be here for you. Be sure and subscribe to this channel so you get my weekly videos all about reproductive health. And until next week, wishing you love, luck, and pineapples.